Marissa Schaefer.
And I'm Jenna Cantor, and welcome to Physiotherapy Performance Perspectives, a physical therapy podcast for performing artists.
Today we're interviewing Mandy Blackmon, a PT in Atlanta, Georgia, who is highly involved in the PT profession. Currently, Mandy is an adjunct clinical professor at Mercer University, and dance medicine is one of her specialties. She sits on the board of the Performing Arts Special Interest Group, or PASIG, for the APTA, and is passionate about working with female athletes and performing artists.
Mandy is here today to discuss emergency backstage care for dancers during performances. Let's dive right in.
So we wanted to start by asking you, why did you choose this topic?
That's a great question. So I think the variability in the level of backstage care that dancers are getting varies broadly across the country, and it comes up as a topic frequently when we're at our PASIG meetings, and when I also work with Dance USA. It comes up as a pretty common topic. We would like to see more physical therapists who are treating dancers and performing artists be better trained in backstage care and emergency care and urgent care situations. The sports section through APTA offers an emergency responder course through the American Red Cross, and I would really like to see more dance medicine professionals take a course similar to that, but I would also like to see that course geared a little more specifically toward those of us who are covering dancers, rather than it focus on football players and taking off helmets and pads. What are the injuries that a dancer is going to get that are very different from some of our other athletes?
This is a great topic. So, bouncing off of that, what would you say constitutes an emergency backstage care?
So, in my work with Atlanta Ballet, we divide that care into two different sort of silos. We have time set aside prior to every performance for about 2 hours where my dancers can sign up for 20-minute slots, and we call that triage care. And a lot of times that is taping and doing soft tissue work and more preventative or maintenance kind of treatment. If something's come up in performance before, we might be addressing it there. But then I also have PTs on site during performances in case anything acute occurs. Mm-hmm. They can respond to that, and they've all been through that emergency responder course, so they're qualified to be there.
So, per that second silo, how does a dancer know whether or not it's okay to continue performing?
That's a great question. Usually it's a decision made between the dancer, the physical therapist, and or physician who's on site. Sometimes we have MDs there as well. And it may also be a decision with the artistic staff. Mm-hmm. So after we've done our initial assessment, whether it's an orthopedic injury or a concussion, we have to figure out with that dancer, based on the choreography that they're required to perform that night, whether we can tape them up and get them back out there, or whether we do need to pull them for that evening. And it's all going to depend on acuity and sort of their level of irritability, mm-hmm. and how severe that injury is.
What are the common urgent care or emergencies seen during performances?
There's always going to be ankle sprains, ankle rolls, that kind of thing. Concussions are one of the bigger emergencies we've seen in the last few years. Mm-hmm. I think it's been a very hot topic with IADMs and some of the other dance medicine organizations, because choreography is getting so much more extreme. Mm-hmm. It seems to be that concussions are getting more common, so that's going to be fairly extreme. But you could have somebody go into an asthma attack or bronchial distress, breathing distress. I had a case last year of one of my dancers ate lobster before a performance and had a full-on allergic reaction on stage. So I had to respond to that more as a medical emergency rather than an orthopedic or musculoskeletal emergency. So the spectrum can be pretty wide on that, but you kind of have to be prepared for anything. Mm-hmm. And those of us who are sitting as first responders sort of sit in the audience and cross our fingers that nothing goes on while we're sitting there.
Oh gosh.
So besides not eating lobster, if
yes.
you are allergic to lobster, what can dancers do to prevent on-stage emergencies?
That's a great question. I think practicing and running your pieces on the stage that you're going to be performing is so important, mm-hmm. because that's when we see a lot of injuries, whether they're acute or overuse, is when that surface changes and then you have lights in your face and temperature issues may be a problem. If you're performing on a raked stage, that's going to change. So I think prepping and practicing choreography on the surface you're going to be performing is huge. And then just our normal healthcare maintenance, getting enough rest, making sure your nutrition's good, making sure that you're taking some quiet time, warming up properly. All of those things we normally tell dancers to avoid injury are going to be most important, obviously, during a performance week when they tend to be exhausted and more prone to injury anyway.
Yeah.
Especially during things like Nutcracker season, when most of our companies are performing 3 and 4 weeks straight. It's also cold and flu season. They're exhausted. They just tend to be not as on and not as focused, which is going to make an injury or an emergency more likely.
Right.
So say worst case scenario happens, you're sitting in the audience, you see that you have to be an emergency responder. What would the plan of action be?
So in our case in particular, our PTs or physicians are sitting in the audience, and we will either get a text on our phone, so we have our phone sitting in our lap, or someone from stage management will come and get us at our seats. They know exactly where we're sitting, and we're going to go backstage and respond to that dancer wherever that dancer is. So if it's in the wings or in the green room or backstage in a dressing room, depending on the level of emergency, we may be on our hands and knees with our medical kit ready to go. But we keep that kit fairly close by, and it's always a case-by-case basis into what you're going to be doing. We are lucky at Atlanta Ballet that we do have EMTs on site during every single performance.
Nice.
But in the case of a more musculoskeletal orthopedic emergency, the PTs are going to be the best qualified healthcare professional to respond to that.
Yeah. Okay, so out of curiosity, what should first responders pack in an emergency kit or bag for backstage, and why?
That's a great question. So our kit keeps getting bigger as we have more and more injuries. So we already have our PT kit packed because we're also providing the triage care that I mentioned earlier.
Right.
And that's going to consist of, deep prep and soft tissue cream, but also any kind of tape you can think of. So I'm going all the way from kinesio tape all the way up to hard, stiff athletic tape and everything in between. I might be using Luca tape, I might be using light plast. I really want to have everything at my disposal in case I have to make up a taping technique or use any kind of splinting procedure to stabilize an extremity or a finger or a toe or anything like that. So tape's probably my biggest thing. Now I have added Benadryl to my kit.
Right, post-lobster.
Yes.
Yes.
And we had all of our dancers go through an impact screening this year for concussion. So all of my staff is also now trained in acute concussion assessment, just so we can make a fast decision on whether that dancer can go back out onto the stage rather than the playing field. Again, that's not something in the kit, but we all have access to that on our cell phones and our iPads.
Nice.
Other things in the kit, I have things like eye wash. I have some wound care things. If somebody were to get a scrape or an abrasion or a cut on stage, which is possible, we keep ice backstage at all times. I think what else we have in that kit.
It's like the Mary Poppins bag
is.
for a PT.
And we keep just adding more and more things to it as we see different types of, quote, urgent care or emergency things arise.
You should get one of those Mary Poppins umbrellas, but it says PT on it, that you pull out first, that kind of grows, and then you get what you need after it.
Yeah,
Exactly.
All right, now it's time for my personal favorite question. So tell us your favorite story about when you were treating a dancer.
Gosh, in an emergency situation or just in general?
Whatever you want. The
Okay.
world is your oyster.
Last year, it was a 2-performance day, and I actually left the theater prior to the first performance, but I knew that one of my dancers was having some fairly acute back pain. And I treated him and calmed him down a little bit, and he was able to perform in the matinee show, and then it got so much worse. Just really, really spasming, and he was doing a very high-level modern piece with a lot of lifts and a lot of groundwork. My former student, my mentee, came in after me and was treating in between the shows. and she was able to calm him down enough that he was actually able to go on that night. And that was probably my favorite, because my student that I had trained, who's now my colleague, was successful enough in carrying on the treatment that I had already started to keep that dancer dancing. So it was sort of a PT moment, but also a teacher moment. And I was pretty proud of that.
Nice.
That was cool.
That's awesome.
Well, that wraps it up for today. Thanks for joining us, Mandy. And thank you to our listeners for joining us for another episode of Physiotherapy Performance Perspectives. Join us on the first Monday of every month for the next episode.
To hear more episodes, click on the link in the description below to view our website, like us on Facebook to stay informed. And finally, if you want to get in touch with us for anything, please email us at ptperformanceperspectives@gmail.com. Thank you so much.
Thanks, guys.
Bye.
Thank you.